Hey everyone, so I've compiled a list of a few nutrients that can get depleted by certain types of blood pressure medications. Um, this can be one of the reasons why people have side effects from their medication. So we're going to just go through a few. The two main categories that I decided to choose for this video for nutrient depletion from blood pressure medications is angiotensin receptor blockers, also known as ARBs. So examples of this would be amlodipine, candesartan, irbesartan. Artan basically is the ending of these. They may have a different name depending on which drug you choose in the brand, but yeah, so ARBs are angiotensin receptor blockers. The nutrients that can get depleted are magnesium, potassium, and zinc. And then the other one is diuretics, particularly loop diuretics, can deplete the body of calcium, magnesium, potassium, sodium, vitamin B1, B6, vitamin C, and zinc. So we're going to go through a few of those nutrient depletions right now. So zinc deficiency can look like, where was it here? Okay, hair loss, changes in nails, diarrhea, more infections, feeling irritable, loss of appetite, impotence, eye problems, weight loss, wounds that take a long time to heal, lack of taste and smell. Potassium, I don't see this as often, but decreased brain function, high blood sugar levels, muscle paralysis, difficulty breathing, irregular heartbeat, and I'm not naming all of the different deficiency symptoms. Having vomiting, I'm sorry, that's a cause of why you can get deficiency. Magnesium deficiency can lead to problems like high blood pressure or high blood sugar, osteoporosis, migraines. It can cause loss of appetite, nausea, vomiting, fatigue, weakness, shaking, pins and needles, muscle spasm, pins and needles sensation on your skin, muscle spasms, hyperexcitability, sleepiness, abnormal heart rhythms. Thiamine, which is B1, can look like fatigue. Deficiency of this can look like fatigue, irritability, poor memory, loss of appetite, sleep disturbances, abdominal discomfort, and weight loss. And vitamin B6 can cause inflammation of the skin, a red, greasy, scaly rash. May feel numbness and prickling like the pins and needles sensation I told you before. The tongue may become sore and red. Cracks may form in the corners of the mouth, right here. That's not just B6, by the way. There's a couple other nutrients for that. People may become confused or irritable, may have seizures. And in general, they can just have mood issues when there's deficiency of B6. And I know that also from reading about oral contraceptives depleting B6. Women can get more moody when they are on oral contraceptives, and it could be because they're depleted of B6. So I say all of that to say that if you are experiencing side effects from your medication, you may want to check what class of drug your medication is in, what's the mechanism of action. So it could be a diuretic, a loop diuretic, a thiazide diuretic, an ARB. And then you can look up what nutrients that class of medications depletes and see if maybe some of your symptoms line up with the symptoms of a depletion of that particular nutrient. If that is the case, you may want to consider supplementing with that nutrient. Now, dosages can vary, of course, right? And that may be something a naturopathic doctor can help you with. And the reason I say all that is like, well, you could say, well, if it depletes all these nutrients, what's the point? Let me just go do something natural. Yeah, maybe over time, right? But in the moment, I'm an advocate of people staying on their medication until they find something that naturally works really well. Because you don't want to be in this trial and error process of trying to find something natural to help with your blood pressure. Your blood pressure's high or it's fluctuating, right? That's not a good situation for the rest of your body. You want to stay away from risking yourself having a stroke. You want to stay away from risking yourself starting to have kidney damage and thus getting into compromised kidney function decline. So this is one way to have a better experience on your medication.